welcome and thank you for joining us today. Could you start off by telling us who you are and what you do?
Cool. So good morning, it's a pleasure to be here. So I'm Angie Rantell. I am a consultant nurse in Urogynaecology at King's College Hospital, and I'm a senior lecturer in professional practice in physiotherapy at Brunel University.
Lovely. And you're here today to do a talk about bladders?
Yep, so I'm going to talk about not only lower urinary tract symptoms, I'm also going to talk a bit about pelvic floor dysfunction, prolapse and other common problems that affect women.
And could you tell us what actually causes bladder problems in MS?
So firstly, I want to say that there are lots of women, 1 in 3 women without MS will develop some sort of bladder problem. And so bladder problems may not be anything in association with MS. However, we do know that for women with MS, they are more likely to develop certain types of problem. And it generally goes along 2 lines. It's either they developed an overactive bladder, so they get an urgency to go and have to go rush into the toilet and don't make it in time, or they have a problem with the coordination of the nervous function to be able to empty their bladder completely, or they may get a combination of both of those problems.
What are the most or best ways to treat these issues?
So it's very dependent on the impact the symptoms are having on quality of life and the day-to-day health, and working on promoting health and preventing harm.
Yeah.
So if they're not emptying their bladder completely, then that puts them at risk of developing urinary tract infections, which obviously have a significant impact on health and potentially MS symptoms. So it's about doing things to prevent infections. For other bits, there's a whole different variety of symptoms based on the severity of problems and how much it bothers someone. We would always start with conservative therapies, looking at things such as lifestyle advice, managing constipation, weight loss, bladder retraining, pelvic floor muscle training, and looking at coping mechanisms on a day-to-day basis. We'd then go to pharmacological treatments for certain conditions and a combination of those. And then in some cases, we'd look at more invasive therapies. But we'd always start with the simplest things first and work our way through a variety of treatments until women are at a point where their symptoms are managed and not bothersome on a day-to-day basis.
Brilliant. You mentioned the word preventative. Now, often when we talk about bladder problems, we start talking about it when there already are issues. But as you pointed out, a lot of people, women specifically, will have bladder problems in their life. So actually, people with MS who are listening to this and don't have any problems at all, is there stuff that they should be doing to try and prevent it?
Absolutely. So basic health promotion activities. We know that if women are overweight and obese, they're more likely to develop problems. So maintaining a healthy weight. We know women that exercise are less likely to have problems from lots of different factors, so being able to exercise. We know avoiding constipation, which I know is often a problem in women with MS, but constipation can significantly cause or worsen bladder symptoms. There's a whole lot of misinformation in the media about how much people should be drinking. This whole thing of having 8 pints of water a day and stuff. And it's rubbish. You don't need that amount. And the harder you make your bladder work, the more problems you may potentially have. The whole thing with 8 glasses a day, those glasses are 200 mils. So that's 1.6 litres of fluid a day. And that doesn't mean just water, that is all of your fluids, tea, coffee, water, juice. So it's about not over drinking and working things. And then it's about keeping the area healthy. Pelvic floor exercises are the biggest one for women, not only to maintain bladder and bowel function, but for sexual function as well. And it should be something that we are doing every day as part of our routine daily health.
And that goes for any age?
That goes for any age. In order to keep your muscle strength that you have to do your pelvic floor exercises once a day. In order to improve the health and the benefit and reduce symptoms, you need to do them 3 times a day.
3 times a day, right. I think it's interesting, isn't it? Because we talk much more about bladder things, but often, like I say, it's more about, it's already a problem there. So I think, especially for people who are listening to this who don't have any problems, get started doing them 3 times a day.
Absolutely. From a preventative point of view, it will keep you in good stead through other challenges in your life that may cause increase in bladder symptoms, such as menopause, such as the impact of aging on the pelvic floor. There are lots of other things that affect a woman throughout her life course that can impact the bladder and the pelvic floor. So the more you promote health and keep it healthy and strong early on, the better you are for later down the line.
So if you're having other problems, like we mentioned UTIs and things like that, what can be done about that?
So often, if you're having symptoms of recurrent urinary tract infections, so that's more than 2 in 6 months or 3 in a year, the first thing you need is an assessment by a specialist. They need to look and see if you're emptying your bladder. You may need to have some tests done, such as looking a camera in your bladder, to make sure there aren't any other causes, such as stones in the bladder or things that you can get from lots of different reasons, or potentially side effects of medications. Based on that, if it's due to not emptying your bladder, then you might be taught other techniques of how to empty your bladder, such as learning intermittent self-catheterisation. If it's a case of sometimes avoiding techniques, changing diet, there are medications to prevent infections. For those that are postmenopausal, looking at some topical hormone replacement therapy prevents urine infections. So there's lots, again, of simple conservative things, such as just looking at what you're washing with and how you're wiping when you go to the toilet. Then medication therapy and techniques that are a bit more advanced, depending on what the underlying problem is. But it's about seeking help, having an appropriate assessment, and then we can work through.
And if you think you are having problems, what's the best way? Do you go to your GP, or do you mention it to your MS nurse?
So it can be through a combination of them. So the GPs are generally the first port of call if you're having symptoms, because you'd be taking urines to have tested there, or you can have an appointment with them. However, I also receive a lot of referrals from MS nurses from when, as part of their basic assessment, they've asked and covered all systems, and they've recognised that people have been developing symptoms. And so I accept referrals from both, and my view is as long as the patients are getting to me to see me, I don't mind where the referrals are coming from. So people need to have the options available, especially at the moment, because sometimes access to GPs isn't always the easiest.
I was just wondering, what are the waiting times at the moment to go and see a specialist?
Depends in where you live in the country and which service you're going to. There are several different types of specialist services that you may be referred to. You may be referred to a community continence service as a first line. You may be in a hospital setting referred to a continence team, a urology team, a urogynaecology team. So it's very much dependent on the team that you are sent to, whether it's community, whether it's hospital, and your local area. I wouldn't like to tell you one thing and it be completely different. It's very dependent on your local area.
But it's good to start getting the ball rolling.
Absolutely.
As it is. Yeah. So we talked a little bit about pelvic floor exercises and other things. Is there anywhere where people can actually go and see these type of exercises and learn about how to do them?
Yeah. So there's lots of different sources of information. If you go onto YouTube and type in pelvic floor exercises, there are videos that give advice. You always have to be careful about content you find online. From a UK perspective, Bladder and Bowel UK, which is one of our national charities, have information and advice sheets online. The Pelvic Obstetric and Gynaecology Physio Group also have a patient bit that has a whole group of information about pelvic floor exercises. But again, the International Urogynaecology Association have a patient-facing website called yourpelvicfloor.org, and that has a whole group of information leaflets about bladder conditions, not necessarily associated to MS, but for general population. But they also have videos on how to do your exercises and information that any woman can access.
Quite often we hear people talking about they don't actually leave their house because they're worried about having accidents and things. Is there any schemes or anything that sort of can make it easier for people to get out and about, like accessing toilets, that sort of stuff?
Absolutely. So the first thing often is we know that psychologically bladder symptoms have a huge impact on anxiety. The biggest challenge is anxiety has a massive impact on the bladder. So when you think about it, so people that don't have a bladder symptom, when they're nervous before an exam or an interview, They want to wee. And it's because the centre for anxiety in your brain is next door to the centre for your bladder. So the more anxious you get about something, it sparks your bladder centre off and makes you think you want to pee even when you don't. So one of the biggest things we start to work on is managing anxiety.
Yeah.
And in order to manage anxiety, we work on coping behaviours and looking at techniques to try and help people. So we'd look at modifying fluid intake to do. There are certain things that people can buy online called radar keys, which gives them, and they, I'm guessing from an MS point of view through the charities, that give them access to disabled toilets. That then links in with an app that you can download on your phone called Wheelmate, that then does location services to track the access or to track all disabled access toilets or radar key toilets in the area wherever you are. Because often it's the not knowing where the nearest toilet's going to be that increases the anxiety that causes the symptoms. So by having an app on your phone that can locate things, having a key that you know can get you into a certain toilet, are the first steps. There are other coping mechanisms that we can try and help people with, but the first thing is by getting an assessment and trying to have symptoms managed. If your symptoms are managed, the anxiety goes and it gets back out there. So it's about getting that first step towards seeking assessment and treatment that will then help people get their quality of life back as we improve their confidence.
What would you say to people who are a bit embarrassed about it and sort of need to talk to someone, but they're struggling?
Yeah. So that is a common thing that we've been seeing for years. It's always been thought of as a very private thing, a very taboo subject. And we know that for, the 1 in 3 women that have bladder symptoms in the UK. So there are more women in the UK with bladder symptoms than those with asthma, epilepsy and diabetes combined. But studies show only about 26% of people seek help, either because they conceive it as a natural part of ageing, natural part of childbirth, or because of embarrassment.
Yeah.
But the reality is there are teams of us here that this is what we deal with for a living. We aim to try and reduce and make it as comfortable as possible for people to come and speak to. But until they make that first step, we can't help them. So it's about encouraging that there are lots of people in that situation. There are lots that we can do to help you. Please just be brave and take that first step to hold your hand up and say, I have a problem and I need some help. And then you'll get directed into the right specialist.
Brilliant. Thank you so much.